Welcome to the Friday Focus. My name's Dr. O from E&S Orthodontics. And today I'm going to be continuing looking at some common orthodontic problems. And I know that in the month of January we were highlighting reasons why to do orthodontic treatment at the age of 7. And so now what I wanted to do is kind of take you into put you in a position where you or your family member has braces or are using an Invisalign. And so one of the things I want to talk to you about today is soft drinks and orthodontic treatment. And as you can see from the title of the slide, it's a recipe for disaster. And what I wanted to do is kind of highlight why we say it's a recipe for disaster. And so, as you're going through orthodontic treatment, I want you to be aware of this. So what we want to do is understand that soft drinks, which has a lot of high acid and sugar component, can actually weaken the enamel of teeth. And how that occurs is acid is the culprit, and soft drinks contain a lot of acid. And so acid pulls calcium out away from the enamel, thereby causing the enamel to become softer. And if the enamel becomes too soft, that can eventually lead to a cavity. The second component that's troublesome is sugar. So the acid plus sugar. And so if you're eating a lot of sugars in your diet, then having soft drinks and the sugars combining together really creates a problem for us, because it actually increases the chances for these decalcification spots or white spots to occur. And so, when you have food and you're not doing a really good job brushing, plaque forms around the bracket of the tooth. And when the plaque forms around the bracket of the tooth, the bacteria that's there or that's sitting on the bracket of the tooth then secretes acid, just like the soft drink. And as a result, it also weakens the enamel. And so a lot of times people can come out of braces and they can have straight teeth, but then they have awful looking teeth because of the decalcification spots or the white spots that occur. And the reason that is because it's not because of the braces, it's actually because of how the teeth were actually cared for during the orthodontic treatment. And some people actually try to avoid, they say, oh, well, I don't want to do braces, but the problem also occurs when you're wearing an Invisalign. When you wear Invisalign, the aligner acts as a well for the acids to sit on, and then when you put the aligner onto the teeth, the acid just sits there just like it would around a bracket. So it's a little bit less problematic with aligners, but again, both of them can actually cause decalcification during orthodontic treatment. And so one of the advices that we really want to give you is really to try to avoid soft drinks. So when we're looking at soft drinks, why does it actually cause this problem? And so the reason is that when we look at soft drinks, we notice that they have a very low pH, which makes them very acidic. Water has a pH of 7. Hydrochloric acid has a pH of 0. And so when we start looking at the different types of soft drinks that are available, whether they're regular or diet, or we start looking at sports drinks or fruit drinks, they all have a very acidic component to it. Well, when we're looking at the life cycle or this problem that occurs, we're really looking at the life cycle of a cavity. And so the life cycle of the cavity starts out with plaque and sugar. So you remember, plaque is caused by having food that accumulates around the bracket, and plaque also occurs in with normal people who don't have braces on. So everyone gets plaque. And so it's the bacteria in the plaque, and then they secrete byproduct is acid, and then the acid causes decalcification, which then causes permanent white marks on the teeth. And if the acid sits on too long, it can eventually create a cavity. And so what we want to do is make sure that as you are in orthodontic treatment, you want to avoid soft drinks. You want to try to drink more water and milk. And you really want to brush and floss on a regular basis. And you want to listen to our assistants or our recommendations on how to actually brush your teeth. So And if you are like just, you know what, I'm like a proponent, I can't go without my soft drink, then what you want to do is drink through a straw. Maybe drink your soda through a straw versus drinking it directly from the can or from the bottle. And then have your soft drinks with the meals so that the acids can be kind of flushed away from the teeth with the food, and then brush right away after drinking. I know it sounds tedious, but we're really out to create a beautiful smile, and you can't have a beautiful smile if you have decalcification. And then that just becomes expensive to fix after orthodontic treatment. So we really want you to avoid those costs and really look and concentrate on doing the best that you can hygienically while you're in braces. So hopefully this will give you a little bit of an outline of our belief about please try to avoid soft drinks during your orthodontic treatment, and hopefully it kind of gives you a little knowledge on why we do recommend you do brush your teeth properly over the course of treatment. Have a great weekend. We look forward to seeing you next week on the next Friday Focus.